Good evening, and thank you for joining me in discussing an important issue, which is the growing threat of cybersecurity attacks on rural hospitals across the United States. This brief is addressed to the U.S. Secretary of Health and Human Services, the Honorable Javier Becerra, and given his pivotal role in shaping national healthcare policies, he is uniquely positioned to tackle the vulnerabilities faced by rural hospitals. This is a crucial time to address cybersecurity in healthcare due to National Cybersecurity Strategy released on March 1st of 2023, which highlights a 128% increase in cyber attacks on our healthcare system. These attacks are not just an IT issue, they are a serious threat to our healthcare infrastructure and patient safety. This policy analysis using Bardak's Eightfold Path explores these challenges and offers practical solutions. Currently, the National Security Council has flagged the U.S. healthcare and public health sector as a top priority for cybersecurity upgrades. This is especially important for rural hospitals, which are now facing increasing threats in lieu of limited resources. The most significant threat to our nation's digital landscape is ransomware. This form of malware exploits system vulnerabilities via phishing or compromised websites. It encrypts data and demands payment for decryption, but payment doesn't necessarily guarantee full restoration of data. These attacks can disrupt hospital operations, delay patient care, and lead to significant financial losses. So why are hospitals such a prime target for cyber attacks? One is based on the critical nature of operations that occur within hospitals. So attacking hospitals can disrupt life-saving procedures, making hospitals more likely to pay ransoms to regain control of their systems. The complexity of IT systems in hospitals cause them to rely on interconnected systems which create multiple entry points for cyber attacks. This complexity makes it easier for attackers to find and exploit weaknesses. And the large amounts of sensitive data makes hospitals especially a target of cybersecurity attacks. And these hospitals store valuable personal information such as medical histories and social security numbers. And this data is highly valuable and is projected to be worth 10 times as much as credit card numbers on the black market. The theft of medical records can seriously impact patient care and disrupt services. This highlights the urgent need for specialized cybersecurity measures within this sector. And when examining rural hospitals, they face heightened risks due to several critical factors. One is outdated technology. More than 60% of rural hospitals use outdated or unsupported software, making them vulnerable to cyber threats. Urban hospitals generally benefit from more advanced technology and stronger cybersecurity measures. The financial constraints experienced by rural hospitals compromises their ability to pay for ransoms, invest in IT upgrades, and repair damages from cyber attacks, which further complicate their recovery efforts. And under-resourced IT departments cause many of their employees to handle multiple roles, which can hinder effective systems management and cybersecurity measures. As a result, rural hospitals struggle more than their urban counterparts to recover from cyber incidents. These factors have likely contributed to the 32% increase in ransomware attacks on rural hospitals in recent years. And it's speculated that rural hospitals experience more cyber attacks than their urban counterparts. However, it is shown that ransomware attacks disrupt operations at similar rates in both rural and urban hospitals. Yet, rural facilities experience disproportionately severe consequences that lead to prolonged operational disruptions and increased risk to patient care and hospital viability. So, in rural communities, disruptions like ransomware attacks have several effects on both patient care and hospital viability. From a financial standpoint, rural hospitals face a revenue reduction of 21 to 28% during disruptions, which worsens their already unstable financial situation in comparison to urban hospitals. Regarding increased travel distances, in rural areas, patients may have to travel 4 to 7 times farther than those in urban areas to reach alternative healthcare facilities during ransomware attacks, which can be critical for emergencies like heart attacks and strokes. And regarding cancellation of care, patients in rural areas may cancel or delay scheduled outpatient care at higher rates than those in urban areas due to increased travel burden or even difficulty in finding alternative facilities. Collectively, these factors can lead to higher healthcare costs and worsening health outcomes in rural communities. And this brings us to our problem statement of rural hospitals facing more frequent and severe cybersecurity attacks with longer lasting impacts than urban hospitals.